October is National Depression and Mental Health Screening Month. Today, Rachel Ripp has details on new mental health education programs and resources here in the Midlands.
Taking care of your mental health is just like keeping up with dentist appointments. That's the example Seth Scott, CIU counseling professor, gave. He's the director of a brand new PhD program at CIU that began this fall, focusing on counselor education and supervision. Scott says right now in the state, there's a need for more counselors since people are retiring and aging out of the profession, adding that wait times to see a mental health professional are significant.
We see that we need more counselors in the communities around us. And so while we want to focus on creating those counselors, actually by training trainers of counselors, we can exponentially affect the availability and accessibility of counseling in the field.
Scott explains that when fall comes around, it's important to check back in on your mental health.
Once we hit October, a lot of people's schedules have stabilized. The busyness of summer is over, the holidays aren't quite here. And so October and November do provide opportunity for people to get back into healthy rhythms.
Here in the Midlands, kids under 18 can access an interactive mental health screener at hope.connectsu.org. There's also the Columbia Area Mental Health Center, NAMI of South Carolina, and Richland School District 2 Family Intervention Services. If you or someone you know is experiencing a mental health crisis, you can contact the Department of Mental Health's Mobile Crisis Team at 833-364-2274.
As tragedies strike, as you experience anxiety, trauma, depression, the world kind of shrinks in your view, and you can only really see what's directly in front of you. One of the major functions of counseling is to help people kind of see beyond what's directly in front of them, to expand their scope and their view.
Rachel Ripp, News 19 WLTX.
Over the past few years, depression has become a topic for people to become more understanding of. But do we actually know what can cause depression? It is uncertain what is the actual cause. But according to the CDC, it could be a combination of things ranging from genetics, environmental, psychological factors. They also say that factors one or more could increase your chances of becoming depressed. That includes having relatives who have suffered from depression, experiencing any traumatic or stressful events, having medical problems, or using alcohol or drugs. And of course, we know depression looks different in everyone, but some of the symptoms are the same. If you're feeling sad or anxious, if you're having trouble falling asleep, not wanting to do activities that used to be fun, or having trouble concentrating, then you are urged to contact your healthcare provider.